Canada's drug policy clash. Leaders square off over safe supply debate. The issue of Canada's safe supply drug policy has emerged as a central flashpoint in the ongoing election, igniting fierce exchanges between party leaders. Prime Minister Mark Carney has defended the approach as a compassionate, evidence-based response to the opioid crisis, emphasizing that it is intended to save lives by reducing exposure to toxic street drugs. In his view, expanding access to pharmaceutical-grade substances can help stabilize vulnerable users, connect them to support services, and ultimately prevent overdoses. Carney has framed the policy as a public health measure, comparing it to needle exchange programs that were once controversial but are now widely accepted as harm reduction tools. Pierre, Poilievre, however, has taken the opposite stance, lambasting the Safe Supply initiative as a reckless experiment that enables addiction rather than addressing its root causes. He argues that providing free or subsidized drugs without strict treatment requirements only entrenches dependency, creating what he calls a state-sponsored drug trap. Poilievre has promised to redirect federal funding away from safe supply programs and toward recovery-focused models, including detox centers, inpatient rehabilitation, and long-term support networks. His campaign has repeatedly linked the policy to rising public safety concerns, pointing to cases where diverted safe supply drugs have allegedly ended up on the black market. Alberta Premier Danielle has thrown her weight behind Poilievre's criticisms, warning that the federal policy could exacerbate problems in provinces already struggling with addiction-related crime. Smith has championed a treatment-first philosophy, echoing Alberta's recent investments in recovery communities and compulsory treatment options for those deemed a risk to themselves or others. She argues that without mandatory pathways into rehabilitation, safe supply amounts to little more than harm facilitation, leaving both addicts and communities at risk. Smith has further suggested that Ottawa's stance undermines provincial autonomy, hinting at potential legal challenges should the policy be expanded nationally. The debate has also spilled into the realm of public perception, with opinion polls showing Canadians deeply divided. Supporters of safe supply emphasize that traditional prohibitionist approaches have failed for decades, leading only to more deaths, overcrowded prisons, and overburdened healthcare systems. Harm reduction advocates cite studies indicating that providing regulated drugs reduces the spread of infectious diseases, lessens the strain on emergency rooms, and offers a gateway to voluntary treatment. They also point out that the illicit drug supply has grown increasingly dangerous, with fentanyl contamination making even occasional use potentially lethal. Opponents counter that these benefits are overstated and fail to account for broader community harms. Municipal leaders in some cities have reported spikes in petty theft, aggressive street behavior, and open drug use in areas near safe supply distribution sites. Critics argue that these programs lack adequate oversight and accountability, creating opportunities for abuse and diversion. Poilievre has seized on these anecdotes during campaign stops, portraying them as proof that the policy is eroding public order and making neighborhoods less safe. Carney's team has pushed back hard, accusing Poilievre and his allies of fearmongering and ignoring scientific evidence. Liberal campaign materials highlight testimonials from healthcare workers and recovered addicts who credit safe supply with saving lives and keeping families together. They argue that demonizing the policy risks stigmatizing drug users further, driving them away from the very services designed to help them. The Liberals also accuse the Conservatives of proposing an outdated war on drugs model that has already been proven ineffective in multiple countries. Danielle Smith's interventions have added a provincial-federal tension to the debate. Alberta's model, which prioritizes mandatory treatment in some cases, has been hailed by its proponents as bold and results-oriented, but criticized by civil liberties groups as coercive. Smith insists that the public safety benefits outweigh the concerns, noting that repeat offenders with addiction issues often cycle endlessly through the criminal justice system without meaningful recovery. She has positioned herself as a defender of provinces' rights to set their own drug strategies, framing Carney's approach as federal overreach. The political stakes are high, as the safe supply debate intersects with broader election themes of public safety, healthcare, and the role of government. For Carney, defending the policy is about projecting compassion, modernity, and alignment with international harm reduction norms. For Poilievre, Opposing it is a chance to rally voters who feel their communities are under siege from addiction-related disorder and crime. The issue also resonates differently across regions, with urban centers tending to show more support for harm reduction, while rural and suburban areas lean towards stricter enforcement. This policy divide is amplified by differing visions of what success in drug policy should look like. Carney measures progress in terms of reduced overdose deaths, fewer emergency calls, and increased engagement with support services. Poilievre prioritizes visible improvements in community safety, reductions in open drug use, and higher rates of recovery and reintegration into the workforce. These contrasting yardsticks make it difficult for either side to claim definitive victory in the debate, as each appeals to a different set of voter priorities. Media coverage of the debate has been intense, often framing it as a morality clash between compassion and responsibility. Television panels, op-eds, and talk radio have dissected every statement, with health experts and law enforcement officials weighing in. Some commentators have warned that the issue could become as polarizing as carbon taxes or immigration policy, splitting voters along ideological and regional lines. The safe supply debate has even overshadowed other campaign topics in some areas, dominating local news cycles and candidate forums. Grassroots activism is also playing a role, with rallies, petitions, and social media campaigns on both sides. Harm reduction advocates have organized public events showcasing personal stories of recovery and survival tied to safe supply programs. Meanwhile, community safety groups have held marches and press conferences demanding the closure of what they call drug distribution sites in their neighborhoods. The intensity of this activism suggests that whichever party wins the election will face continued pressure to either expand or dismantle the policy. As the election nears, the safe supply debate is shaping up to be a defining moment for Canadian drug policy. The choice before voters is not merely between two leaders, but between two fundamentally different approaches to addiction, one that treats it primarily as a health issue, and one that views it through the lens of law and order. The outcome could determine not only the future of safe supply programs, but also the broader trajectory of Canada's response to one of its most persistent and deadly public health crises.